join with computer audio.
But you want to turn that off for now because we're not in the meeting yet.
I'm talking. Start talking, my name moved to number 2.
Oh, under the host. Started. I'll call the meeting to order 4:32, and this is July 20th, 2022. The regularly scheduled meeting of the Dubuque County Board of Health. We'll do roll call first. Jessica Smith.
Here.
Adam Hoffman.
Here.
Sandra Larson. Here. We have one other member that is coming. She was going to be late, and then Dr. Schultz. I don't see him yet, but I think he's planning on being here.
I think so. Yeah.
All right, so our first item tonight is a public hearing concerning Chapter 69 Ordinance Adoption. Is there a motion to open the public hearing?
So
I'll second.
All those in favor of having a public hearing concerning Chapter 69 Ordinance Adoption, say aye. Aye. It passes. So we will now begin the public hearing on the matter of adopting Chapter 69 of the Iowa Code as our Board of Health ordinance in place of our current local ordinance, Chapter 34. At this time, anyone may address the board on this matter. Please raise your hand on Zoom or approach the front table if you plan to speak to the public at the public hearing. Include your first and last name as well as your home address. All remarks are limited to 3 minutes. Hi, Dr. Schultz. Is there anyone that wishes to be heard concerning Chapter 69 ordinance adoption? Okay. Hearing none, I guess we can have a motion to close the public hearing. Oh, maybe that's somebody that wants to talk. Let's just wait a minute.
myself.
Sorry. That's okay.
Okay, so there do not seem to be any comments concerning the public hearing. So is there a motion to close the public hearing?
Yes, motion so moved.
Second.
All those in favor of closing the public meeting, say aye. Aye. Okay, the motion passes. We'll be talking a little bit more about the Chapter 69 ordinance adoption later in this meeting. At this time, anyone may address the board on matters of which are on the agenda. Please raise your hand if you're on Zoom, or raise your hand in the room and state your name and home address. Individual remarks are limited to 3 minutes. I'll need a timekeeper if someone does want to speak. So. Okay, anyone wish to speak concerning matters on the agenda? Seeing none, we can go ahead to number 4, chairperson announcements and updates. First, everyone knows this, but I'll just announce that we had 2 resignations since the last meeting from our Board of Health. Marsha Horowitz resigned and Tom Besham resigned. And I would just like to, again, publicly state my thanks to both Marsha and Tom for their service on the Board of Health. Marsha served a shorter period, but she also is chairperson of the Humane Society, so she was getting too busy, but we appreciate her assistance on our board in the past. And Tom served 7 years on the board and was chairperson during a very difficult time during the pandemic. And we certainly appreciate his service and will miss his ability to tell us the history of the board and the department. So I wish both of them the best of luck, and we appreciate their assistance in the past. I'd also like to introduce 2 new members of the Department of Health. First of all, the assistant director has been hired, and that is Laura McCarthy-Cohn. And Laura, we welcome you to the Department of Health.
Thank you.
And also I'd like to introduce the office clerk who was recently hired, Tina Daubenberger. She's in the room here. You don't know us and we don't have name tags, but let me just go around and I'll introduce. This is Jess Smith, Adam Hoffman, Sandra Larson, Dr. Hendrik Schultz, And you know the other two. All right. And I understand you've been a county employee, correct?
Yes, I've been in the county attorney's office for almost 30 years.
Okay, well, thank you very much. And we appreciate your help and assistance and expertise that you can bring to our department and
Thank
the
you.
health department. So welcome.
Thank you. It was nice meeting you.
Thank you.
Thanks.
Thank you.
Okay, next, number 5 is the Board of Supervisors, Board of Health Liaison Comments. And Supervisor McDonough, do you have any comments tonight?
Good afternoon, everyone. I think my comments really are just those of gratitude to the volunteers on the Board of Health and to our new staff members as well who've jumped in participating in a limited capacity in a stakeholder interview that lasted many hours. I just want to thank you for the many, many hours that you have invested in our search for our new director and also interviewing employees for the department. So I appreciate you. I think the Board of Supervisors appreciates you, and we will get right the funding and the staffing. I have great confidence that that will come together, and you still are, at the leading edge of creating, I think, a new day for public health in Dubuque County. So thank you.
Thank you, Supervisor McDonough. The next item is the approval of the agenda. Were there any additions or corrections, modifications to the agenda? Hearing none, is there a motion to approve?
I second.
All those in favor of approving the agenda, say aye.
Aye.
Motion passes and the agenda is approved. Next, we have the approval of minutes, and as you can see, we've been very busy the last couple of months. We have minutes from 1, 2, 3, 4 meetings to approve. Oh, 5 meetings, sorry. 1 regularly scheduled and 4 special meetings, all having to do with the director search. Are there any additions or corrections to the minutes?
Can we approve them all in one motion?
Yeah.
Okay, I would motion to approve all 5 minutes.
I second.
Any discussion? Hearing none, is all those in favor of approving the 5 separate meeting minutes, say aye.
Aye.
Okay, that motion passes. The minutes are approved. Next, we have presentations and reports. The first will be our response to public comments or questions from previous meeting. We had none. Next will be the Food Policy Council grantees FY22 final reports. And are there any questions about that report? Okay.
I can just share if you want me to. That was
Okay.
the last report we'll get from those grantees. They finished out their FY22 year with the Food Policy Council, and that program no longer exists. So if any of those groups are looking for funding in the future, they'll do it as a purchase of service through the Board of Supervisors instead.
Okay, so nobody will be coming, will the Food Policy Council still be coming through here? Or?
Yeah, as of now, the Food Policy Council is still sort of like a part of the health department, but they just do not have funding to award grants the way that they did in the past.
Okay,
So they will have to go to the Board of Supervisors for funding now?
They would go to us and ask for a budget amendment, and then we would probably take that to the supervisors.
but the actual grantees would be going to the supervisors.
Oh, yeah, sorry
Those are-
about that.
Those are
Right.
separate.
Grantees would go to the supervisors if the Food Policy Council wanted funding for anything, including giving money directly to grantees themselves, like they did in the past. They'd
Okay.
have to ask us for that. Ask the Board of Health, yeah.
Okay, do we need a motion to receive and file, or we just receive?
Yes.
Okay. Is there a motion to receive and file this report?
A motion. Second.
Any discussion? All those in favor of receiving and filing the Food Policy Council final reports, say aye.
Aye.
Okay, motion passes. The next matter is the Dubuque County Health Monthly Update and COVID-19 Update.
Okay. Just share my screen to go through a quick COVID update, then I have a few department updates also.
Okay.
So as of last Thursday, Dubuque County is still at a medium level for our community level according to the CDC. You can see the metrics that they use to rank those different levels, but where Dubuque is Our case rate per 100,000 people is at 182.92. Our new COVID admissions per 100,000 is 17.5%. And our staffed inpatient beds in use by patients with confirmed COVID-19 in Dubuque County is 4.9%. We've been at medium for a few weeks now. And you can kind of see that if you track this map on the right, on the CDC website, you can kind of see that more and more of our Iowa counties are moving into medium as well. This is a breakdown of our variants by month in Dubuque County, and you can see for a long time now, we've been experiencing just the Omicron variant in the county. All of our July sequence variants from Omicron are the BA.5 subvariant, but back in June when they sequenced those variants, we had a mix of a few different kinds of Omicron variants. But with all three of the subvariants present in Dubuque County, the incident management team is expecting to see another wave of cases coming our way. And these subvariants are immune evasive, meaning that they can still infect those who are vaccinated, boosted, or have had COVID-19 in the past. But vaccines and boosters are effective in preventing severe illness, hospitalization, and our deaths, of course, which we have seen slow down significantly since the start of vaccinations. But the CDC right now is recommending that a COVID vaccine for everyone 6 months and older, and boosters for everyone 5 years and older if you're eligible. And adults that are 50 years and older and people that are 12 years and older who are moderately or severely immunocompromised should be getting their second booster now. This is a trend line of our cases over time since the start of the pandemic back in March of 2020. And you can see that, here, I'll kind of minimize this so you guys can see. Oh, sorry, wrong screen. There you go. Everyone in the room can see now. You can see that our cases increased in May and they've still been increasing now in July. This page was updated today. It's our new COVID cases in Dubuque County over the last 7 days. And like I just said, you can see our cases continue to increase overall. Our hospitalizations have been increasing as well. If you went back on this page, you would see most of our hospitalizations were down to 4 for a while there in May, but now they've kind of increased and we're at 10 as of today. And then unfortunately, we are at 1 additional COVID-19 death in Dubuque County since this group last met. This is our vaccination by our COVID-19 vaccination data by county. And so you can see that 65% of our total population is fully vaccinated, which is great. And then at the bottom there, you can see 95% of our population 65 and older is fully vaccinated, which is awesome too. And this is our booster data according to the CDC, and it says that 57.2% of those who are fully vaccinated in Dubuque County now have a first booster dose too. But the trend hasn't really changed. We know that those who have experienced higher cases in Dubuque County, those around 19 to 30, are the ones who are the least vaccinated. And that's sort of been the same since vaccinations became available to us. And this is a slide that I just put together showing our trend in COVID vaccinations over time since they first came out in December of 2020. You can see where the peaks of interest are right when the vaccine came out in the fall of 21, which we know was a time where we were seeing a lot of increased cases. And then now these past few months, we really aren't seeing a lot of interest in COVID vaccinations in Dubuque County. Though the VNA still hosts walk-in clinics every Monday or every Friday and every third Monday of the month, and they have yet to have a clinic where no one shows up, which I think is awesome. And with that, we're still hosting our VNA hotline and our Sleeves Up hotline for anyone in Dubuque County who has questions about the COVID vaccine, COVID-19 in general, or needs help scheduling an appointment to get that vaccine. Then I included just a brief update on here, and I'm sure Dr. Schultz has more information to share, but this is a monkeypox update, though I don't have a ton to update you on. Our first case in the US was May 17th of this year, and as of today, we've got 4 confirmed cases in Iowa. Some of the symptoms include rash, chills, fever, and fatigue, And you would see markings on your body similar to that photo up there. And then I just included this map that I thought was pretty astonishing to see just in about a month's time how monkeypox has spread throughout the United States. So this is sort of an up and coming concern that the incident management team has our attention to. Otherwise, that's all I had for the COVID update, unless you had anything else or if anyone has questions.
I just wanted to make a quick comment about the monkeypox one,
Yeah.
because the way you presented the last slide could leave you with the impression that this is spreading like wildfire. And the version of actually reality is it does not. It is a disease that is spread by transmission, but to a way lesser extent and dramatic severity as COVID does. It's not a droplet and respiratory infection. It really requires very close contact. And what you see here is just where it has been found, but the numbers that have been found are incredibly low if you compare the whole population of these states. So I just want everybody to get a sense of, okay, yes, it's there and it is a problem. That's true, but it's not the same magnitude and severity as we've seen it with COVID-19. This is something we have to keep an eye on. That's why we have public health departments and to keep an eye on it on the state level, on the community level. And there are medications out there, there are vaccinations out there. I think the United States have stocked up their vaccinations against monkeypox. So it's a different ball game than COVID, and it's not like a repeat of what we just saw starting 2 years ago, just to put things in perspective.
Yeah, thank you. I appreciate that.
Going back to COVID, I would just also mention that since we met last, we have vaccine for those 6 months to 4 years that has been released since we met last. So just to make sure everyone knows that anyone over the age of 6 months really is eligible for vaccination at this point.
And we are doing some outreach with our childcare providers in Dubuque County too, so that they can help us get that information out to families. That's something we're working on with Randy Gale, the public information officer.
I have a couple questions.
Yeah.
So we're here in July and fall will fast approach. Are we expecting anything in the fall, like a big outbreak or anything that we should be preparing for at this time?
Yeah, and maybe Dr. Schultz has some ideas on this, but I think that the incident management team is staying prepared for that. I don't want to say that we've gotten lax in our response at all. And based on the trend line with the cases and seeing all these new Omicron variants, I wouldn't be surprised if that was to happen. But we do have vaccinations now and we have more developing with the vaccinations too. So it's hard to predict where we'll be in the fall.
Okay, and we still have those masks someplace?
We still have tons of masks that the Board of Health purchased. We have them here at our office and then across the street at the training center.
Okay.
Yeah.
Maybe to what to expect a little bit prognostication. I mean, we will see a respiratory virus season as we've seen every year, a little bit off in 2020 because everybody wore masks and stayed home, but I'm pretty sure we will see this again. What's hard to predict is really what role the new variants will play. What they have done over time is actually they are more infectious but less severe. So it might become something similar to the flu. You get it, you feel lousy, but you don't need to go to the hospital. And as that happened in vaccinated and unvaccinated people in the community, we will get more and more levels of herd immunity that actually contain it and make it less of a problem. Can something unforeseen happen that we have a totally new variant that changes the game completely? Yes, theoretically it can happen, but it is not super likely that we see something like the emergence of COVID in 2020. So I'm cautiously optimistic that we will see a respiratory virus season, which will include flu, RSV, COVID, and other viruses that usually become more prevalent when people get crowded together indoors like they do in the colder season. But I think we're well prepared, as Samantha said, with our equipment, with what we have to offer. And I think the next generation of vaccines that will come out in the fall will also include the newer subvariants, so there will also be broadened coverage. So I think we're in a good spot right now.
Great. Thank you, Doctor. You list the test a number of people who had positive tests on here. And I was wondering if the experts have come up with any estimate, because we know it's totally underreported because there's so many at-home tests. Have the experts come up with any like percentage that we think, okay, we have 191, but really we probably have 1,910, something like that?
Yeah, I haven't heard anything if there's a guess out there, but I mean, we know that, and just from what I've seen, there's more and more people using at-home tests than the PCR tests. Everybody wants a quicker result, and it's much easier than making an appointment. So I think there's a pretty good number out there, but this still gives us an idea.
So word on the street is a lot of people have COVID these days, but a lot of people, and this is what the second slide shows, we pull that up, is a lot of people sit it out at home because these numbers have been staying flat, I would say, since practically February of this year and have only fluctuated a little bit. And that's the one thing that I think really matters, that you say, if we have a high prevalence and a high incidence of that disease, of that infection in the community, so be it. As long as we don't see these numbers coming up very quickly, we will just ride it out and we will be okay.
Good.
Yeah, and same with the number of COVID-related deaths in Dubuque County. Those have stayed low too.
Yeah, good. And you expect, just to clarify this too, you know, in every year we have flu season before COVID was on the radar. And any respiratory season, there were patients who died from these infections or because of their underlying diseases and these infections. So this will not go to zero. That's an unrealistic expectation.
And you maybe are going to talk about this later, but the after action report.
Yep, okay, I can start with that one. So we submitted a request for proposal for an after action report in Dubuque County, which would basically assess the incident management team's response to COVID-19 from the very start of the pandemic until now, and provide us with what's working, what's not working, and ways to improve this kind of response in the future, which I think is going to be really beneficial to not just the incident management team, but also the Board of Health, the Board of Supervisors, all of our community partners. So we did get 3 proposals that came to us. We selected one, and we actually had our first meeting with them this morning. It was our kickoff meeting where we talked about a timeline and talked about what stakeholders we want to include in this conversation that will bring in feedback through surveys and interviews with the organization that's doing this for us. And all of that is paid for through grant funds that we have already received from other agencies. So what was I going to say about that? I forget now, but
Do you know the timeline? I mean.
yes, that is what I was going to say. So the goal is to have it done before Christmas.
Okay.
Yeah.
And when you say paid with the grants, you mean that money that's in our budget?
Yeah, so we have different grants that we were awarded for FY23 that we're able to use pockets of money from those grants to cover the cost of this.
Okay, and it's being shared somewhat with the city also?
It's going to be shared with the city. So there's some funds coming from the city to pay for city specific data. And then it's also now being shared with Clayton County because we share the VNA with Clayton County. So the VNA has, or Clayton County, I guess, Board of Health has also allocated some funding to go toward Clayton County specific data as it relates to the VNA there.
Okay, so are you going to be involved in Clayton County too? Or that's something separate?
Yeah, it'll be like included in the final report as its own section, but it'll be separate and we won't be included in it.
Okay, all right, thank you.
Yeah, so that will be until Christmas. Mary Rose Corrigan from the city will be the main contact for that if you have questions, just because I will be leaving soon. But yeah, I'm excited to see what comes out of it and I'm excited to share it with all our partners because I think it's going to make a big difference in how we work together.
Great.
And then my other update, I just had one more for our department in general on our water testing. We took a break in June from water testing because we had exceeded the funds for FY22. And so now we're back up and testing this month. And in that time frame where we weren't testing for that 4-week period, we got 77 people on our wait list, which is awesome. And we started up testing again on July 12th. Yeah, July 12th. And we've so far gotten 35 of the people off that wait list. So we're making our way through the list. We test every Thursday and Tuesday. And we've got people scheduled out until the end of August. So we're making our way down the list.
Sam, do you anticipate funding will be enough to get us through the year, or are we gonna run into the same issue
Yeah.
in like May or June?
I hope so. I think we've got a better system down where we can space things out, so we don't take a month break like that. But we do also have about $10,000 more than we did last year that was awarded to us through the grant, so.
And I mean, I would encourage the water testing as much as possible. And then if we get to the end and we don't have enough money to do, and we have people that want water testing, I think we could probably go to the supervisors for more money. I would push, don't slow down the testing, just
Okay.
keep going. And then if we run out of money before the end of the year, then we'll deal with that then. That's what I would say.
Yeah, we have a lot of interest in it, which is great.
Okay, good.
Yeah, I don't think we want to stifle interest in
No.
public health efforts, so.
Yeah.
No.
Yeah, I agree. Otherwise, that's all I had for my updates.
Thank you very much.
Yeah.
The next matter on the agenda is the BNA monthly update, and Stacy isn't here tonight, so this is really just a receive and file.
Yeah, unless anyone had questions, I can try to answer them. Otherwise, we can get them to Stacy too.
I didn't have
I
any.
didn't have it.
Is there a motion to receive and file the VNA monthly update?
Okay.
All those in favor of receiving and filing the VNA monthly update, say aye. Aye. Motion passes. It is received and filed. The next on our agenda, number 9, action items. The first item is the Chapter 69 ordinance adoption that we had the public hearing on. Is there a motion to adopt Chapter 69 ordinance?
So. Second.
Good. Some discussion. Adam, do you have anything you'd like to say about it?
Well, I think, yeah, Bailey and Sam have done a really good job with people to help us fall into line with what most people, it seems like we're already doing anyway, but this, yeah, it's the minimum they have to do, so it totally makes sense to have that as our guiding document.
And just as a little background, we're doing this because the state law changed, and then we didn't update our ordinances.
Yeah, we haven't updated ordinances a long time, so it's much overdue, yeah, in terms of
So we're
falling in
just-
line with existing.
Yeah, we're just
requirements.
doing it to get our local ordinance in line with the state ordinance.
Yeah, so I would maybe amend your motion to include that you're going to adopt this in place of Chapter 34,
Okay,
which is the ordinance we have right now in Dubuque County.
okay,
So this will, Chapter 34 will no longer exist, and then we'll just use Chapter 69 when we reference it with our contractors and stuff like that.
okay. Did you make that motion?
Yes. second.
Did I miss anything else at the public hearing on 69? Was there any?
There was no.
There was no
Okay.
discussion.
Okay.
Nothing.
Great.
So you're changing that to include that we're going to,
Yes,
Get rid of
69
the
instead of
old-
34.
yes, okay, all right, very good. Any further discussion? Okay, all those in favor of adopting Chapter 69 ordinance in place of our Chapter 34, was it? Say aye. Okay.
One thing
The,
I would add with that, sorry to cut you off again. I did talk to Auditor Kevin Dragato, and so he's going to get this placed on the Board of Supervisors agenda. He thinks it will be there in August.
okay,
So that should be coming. It won't be official until the Board of Supervisors pretty much do the exact same thing the Board of Health just did.
okay, very good, thank you.
Yeah.
So I'm glad we've got that taken care of. So the next item is B, the variance request by CK Development.
Actually, what was sent out in the packet had the wrong name on it. It's actually Greg Adams, and you have in front of you the correct.
Oh. So it's Greg Adams,
Correct.
and he's doing so on behalf of a development? Is that right, or?
Yeah, he is the owner of the property. He
Okay,
works alongside CK Development to complete the project. And I believe Bailey Avenarius is on too, so she should be able to chime in if you have any questions about it.
could she just explain the first one to us?
Hi. Yes.
Hi, Bailey.
So
Yeah, there you go.
there you go. So Greg Adams he owns the existing farmhouse located in Country View Estates, lot 11 northeast, southwest, south off of Hales Mill Road. So they're adding an addition, and we located the septic tank last winter. But before they started the addition, or after the addition was already added, they located the septic tank and found that the septic tank is only 6 feet from the dwelling and the setback is 10. So he's requesting a 4-foot variance from the septic tank to the existing dwelling. And then they will be replacing the drain field.
Will
If-
will this set a precedent?
What?
Will this set a precedent that we don't want to set? Accepting that they did this before locating, they kind of put the cart before the horse. I think it sounds like they didn't locate the septic before they put the addition on.
Yeah, that's true. They didn't. We found out after, and Sam and I actually went out and we found out after that it doesn't meet the 10-foot setback. So they're asking for the 4-foot variance so that they can keep that septic tank there instead of having to replace the septic tank, but they do want to replace the drain field. So they just want to use the existing tank. So they would need that 4-foot variance.
So normally we would identify the location of the septic tank prior to the.
Right, yeah.
I mean, I think CK Development and Greg Adams, they're well versed in building and things like that, aren't they? I mean, I think he's a realtor.
Yeah.
Yeah.
A long time realtor.
Are you here? Hi, are you Greg?
Yes, ma'am.
So you're the person requesting this variance?
Yes, ma'am. Do you want me to come up here? Or-
You may, if you have something you'd like to say.
So yes, I'm requesting a variance, and CK Development did put the cart before the horse. And we're asking for a 4-foot variance that will not affect the ability for the tank to be pumped. No neighbors are objecting to it. If you don't give me the variance, then we spend $10,000 or $15,000 moving a tank 4 feet. I know in the past you have given variances, so I'm not trying to set a precedent, and I'm not the one who did it, and yes, it was done wrong, and on behalf of Kevin, we apologize, but it wasn't meant to not follow the rules. But that's really all I have to say. We're asking for a variance that won't hurt anybody.
Now, this type of requirement is basically for, just so that the tank doesn't get disrupted, is that what you think?
Yeah, or if it leaks, it's really close to the house potentially. So I mean, it's, yeah, is this gonna be sold later on, or is it?
Yes, and I just bought the property 6 months ago, and everything passed. I mean, it's a newer tank. It's not an old one.
That's what's my other question too. So it's gonna be there for a while before it'll need to be ripped out.
I think it was put in like an 03 or 04 without being exact.
How long do they usually last?
40?
Tanks will last a long time. I don't know the
Yeah,
exact.
I don't know either, but yeah.
Mine
it's-
is somewhere over 50 years old.
Yeah.
Okay.
Yeah.
It's a good chunk of time.
Okay, anyone, is there a motion?
Can I make it?
No. Only if you get on the board of health.
Yeah. There are 2 members.
Yeah, just, can I discuss?
Yeah.
I'm just torn because it
Yeah.
doesn't make sense to cause extra money, but then at the same time, yeah, the precedent's part of just.
I mean,
Asking
it's
forgiveness
just
rather than
dangerous to
anything.
do the precedent, because then everybody says, well, you did it this time, why won't you do it? It's a hard line, and it's horrible for the person, but also for a board, for the integrity of the board. It's a thing to consider.
So you're telling me the board has never made a variance before on setback, never on a septic tank?
Oh, we certainly have.
I don't know.
But usually it's in advance, right? You'd ask for the variance.
Right, and again.
Yeah. I know it's not you, but I mean, that's,
Mistake, but
yeah, the standard.
Had I come in advance, you would have given it to me. The only difference now is I put the cart, and again, I admit and apologize for the mistake. But you're not setting a precedence in the sense that you do give variances. I'm not the first guy to do it. I may be the first guy to do it out of order. And I don't.
Which
wanna
would
pay-
be, yeah.
But I don't want to pay 10 or 15,000 for that. I mean,
Yeah, no, I get the money standpoint for sure. Yeah.
So I did tell Kevin from CK Development next time that he will, like, it is very important that he relays this information to us in the future. So I don't know if that helps any, but
Do we have any idea how many variances we've granted either pre or post historically, Bailey?
I, off the top of my head, I don't know.
I want to say in the past 2 years since I've started, we've only had 5 or 6 variance requests.
Yeah, I would say that's right.
And they haven't all passed.
I mean, I don't see this being like a health hazard or anything. But it is still, you can still access it when they go to pump it and stuff.
Would you, Chair, would you allow just a comment from a supervisor?
Yes.
So in the broader context of this, recall that there was a time when the county was not aggressively inspecting septic tank systems. We know that, which is why you have just adopted a new ordinance. And so I appreciate your concern about precedent, but you know, we have to create a culture and a climate throughout Dubuque County that builders come to us and that Bailey is doing those inspections, and that's going to take time. She's been meeting with contractors. So I think our future will be better, but you know, that I think I would like it. I just would suggest you weigh that. I don't know, this building was done many years ago. There's not a common practice right now, maybe, of doing these, get permission first. So we just want to take that into account. It's going to take time for Dubuque County to have a history of doing this in the proper order.
Thank you. Mr. Adams, is it the new addition that is closer to the septic tank, or is the whole house close to the septic tank?
It's my understanding that it's a new addition, because again, it was inspected, I believe it was put in properly in 03 when it was built. And when I bought it, it was pumped and inspected and passed. So it's my understanding that it's a new addition.
That is correct.
And our environmental specialist, Bailey Avenarius, has stated that she does not think it's a health hazard. The septic tank is still accessible for pumping and it meets the rest of the setbacks. Is that a recommendation, Bailey, that you think we should pass this variance?
I don't see an issue passing it, but I did stress to Kevin how important it is to keep us in the loop.
Okay.
So.
Is there a motion at this time?
I mean,
I'll motion to.
Okay, is there a second?
just want to make one
Sorry.
comment. No, one comment. I would be in favor also of the motion. I think what we should do is a very clear statement that going forward, this will not happen again. So that the process is you asked before, and then we can actually evaluate it, because otherwise we really set the precedent if we don't make this clear. So I agree with the motion. I would second that, but I would say under the assumption that going forward from this day on, we will not retrospectively grant any exceptions.
And I won't be here again. And I respect that. I mean,
And of course, if the county attorney was here with us tonight, we could ask the county attorney an opinion, but they're not here. Is there an emergency to do this, or?
well, man, we don't want to continue if we have to tear up the yard and move it. So it's not fair to say it's an emergency.
Okay,
I guess, could we table it and ask for the county attorney's opinion
I
and
think
then
we
bring it
could.
back for discussion in August?
I think we could. I would like to, I mean,
Okay.
I think we should probably, the thing I would like to know is, from the attorney, is if we pass this, but with a caveat on it that this is the last time or whatever, if that would be at all useful or binding or anything like that. So I think we would like to table this, and is there a motion to table?
I'll move to table till August.
Okay, second?
I would second.
Okay, any discussion about tabling this variance request for a legal opinion?
My only discussion is I support Supervisor McDonough's comment about wanting to maintain kind of openness with the Department of Public Health and wanting to make sure that people are contacting us for well water or, you know, for testing and septic testing. So I would be in support of actions that encourage people to utilize public health.
Yes.
Yeah, and I thank you, Mr. Adams, for bringing this and asking for the variance instead of just, you know, trying to do it under the table, because you could have. And so thank you.
Not the intent all along.
All right,
So if I understand it, you're gonna get an opinion from the county attorney in terms of, I know you can do this, what's,
the additional language in the motion that we don't want to do this going forward. Just that type of, we have some questions for the attorney to ask, and then we'll bring it back on the agenda after we get that advice, okay?
thank you for your time.
All right,
Thank you.
Thank you.
Did I think we need an approval to table it.
I motion, did you second?
Then did we vote?
Oh, no,
We discussed, I think.
You're right.
Yeah, I think we discussed, right? So I think we need to
we didn't
vote.
vote.
No.
Okay, all those in favor of tabling the variance request from Greg Adams to August for a legal opinion, say aye. Aye. Okay, that passes. All right, the second variance request is for 16387 Country View Court. Bailey, do you have?
Yes.
thoughts?
Yep, so I visited with John Lukey last Friday, who resides at 16387 Country View Court. He's requesting a 5-foot variance to install a concrete pool deck around the pool that he will be installing in his backyard. The concrete pool deck would be 5 feet from the septic tank, which would still, they'd still be able to get around a pump. The drain field does meet the 10-foot setback to the concrete pool deck, but John is requesting a 4-foot variance from the drain field to the deck if needed. Just kind of being proactive. And I don't see this being a potential health hazard, but I do recommend that the pool water be tested every month for total coliform bacteria and E. coli for the next 6 months. If the water sample comes back absent every month for 6 months, then I recommend that the homeowner gets it tested every year for total coliform bacteria and E. coli. I believe once the pool's installed, that John will test the water for 1 to 2 months. And then when he closes it up for the season, he'll start retesting in the spring if it's for those 4 to 5 months. And then if it comes back absent, testing every year. And these are just pictures from when I visited last Friday.
I do appreciate the proactiveness of this request. Are you the homeowner?
Yeah.
Do you have anything to add?
I guess it's just the concrete decking. The pool was actually probably more like 20 feet from the septic. I don't know what to say other than that, I guess.
Adam, do you have an opinion?
Yeah, I mean, I think from the leaking part of it isn't gonna be a big deal, so I can get to the house or anything, and yeah.
And the leach field is actually, because this doesn't do it justice, is
downhill.
down a hill,
Yeah.
so the pool level, the bottom of the pool will be like 5 feet above the top of the drain field.
Can you speak, or maybe Adam, you know, the additional 4-foot variance from the drain field if needed, is that?
Yeah, I'm intrigued about that one, just.
Well, when they set it and then my slope, it is right into a slope, so I don't know how to get the feel, the concrete to stay. I don't, you know, and when you place it, it's not exact within inches or whatever. I am right at the edge of the 10 feet variance to the 6 feet decking, like right there at the mark.
Yes, that extra, he's just requesting the extra 4 feet in case when they start digging, if they go over. And then it wouldn't meet the 10-foot setback.
So it's not planned necessarily, it's like just in case. Or
So you don't have to come back.
Right.
Just trying to be legit. It's not a problem.
This was the one I said that we shouldn't approve unless we all get to come and use the pool.
Works for me.
Yeah, I mean, I don't have an issue with that.
The issue I have is, you know, we have a rule and it's beginning to feel like we have a rule just so that we can break a rule. I mean, or do a variance, so I'm not sure about this. Is this a state law about the 10 feet setback? Yes?
But yeah, I mean, that's what the variances are for. If it doesn't meet the 10 feet or, you know, any of the setbacks, they would have to request a variance.
What I find different about this case is it's a proactive ask instead of after the fact. And so I support this one.
Yeah, and for me, it's a pool is a little different, just because I mean, it's away from the house, there's gonna be less like heavy equipment on it and stuff like that, and leakage stuff is terrible, but yeah, not into the house and stuff like that. So the other one, like future homeowner buys this and there's the variance that leaks in because there was that, yeah, it was so close, but yeah, here if they're testing the pool, it shouldn't be an issue. So yeah, the proactiveness and it's,
It would-
for the
That's
food
what
price.
that's what you're saying. Yeah, no health risk, no health hazard, yeah, okay.
It would be interesting to know just statistically how many variances we're seeing, you know, statewide in laws like this, because just from a curiosity perspective.
Yeah, we can try to look that up. I've never looked it up before.
Or at least
Yeah.
some data for the county.
Mhm.
Yeah.
You know,
And to Ann's point before, just how many of these before we're seeing now that we just went in 20
Yeah,
years ago.
yeah.
and didn't
Right,
care.
and that's what I appreciate. Thank you.
Yeah.
I would motion to approve this variance.
Is there a second?
I second.
Any further discussion on this variance? Hearing none, all those in favor of granting this variance for 16387 Country View Court, say aye.
Aye.
All right, that passes. Let's see.
Might I ask you a question? How do I move forward then? That goes to
You'll work
the
with Bailey.
zoning and they approve a permit then?
Yeah, and you can get in touch with Bailey, Ebenarius, and then in zoning, you'd get in touch with Amy, and they'll work with you.
Okay, thank you.
Don, you can just call me when they start installing the pool. And then after it's completed, that's when you can start the test. And then you'll just, when the results come in, you'll have to make sure to get those over to us, or you can email them, drop them off. And you'll have to get that tested at the city of Dubuque. They test pool water.
Okay, thank you.
Okay,
Yes, and please do test it as often as Bailey's recommending or more.
all right, thank you.
Thank you.
All right, so our next item is interim executive director resignation, signing authority and support during interim. I think none of us are going to accept the resignation. I think we already did accept it. Anyway, so what this is your last day, Samantha, is coming up in August, correct?
Yeah, August 12th.
August 12th. And after that, then someone has to have authority for signing.
Yeah, they would be the one signing any claims we have, which is in the way that we pay like the VNA for their services or any other group that we have to pay for an invoice.
And then, and what is, and support during interim?
That was something that you had asked to put on there, just talking about if, we don't know how long this gap will be between my last day and the first day of the new director. So I think when I was meeting with Sandra earlier this week, we talked about Board of Health having a conversation about what that looks like for the staff that will be at the office. And I did talk with Mary Rose and Stacy Killian, and they're willing, more than willing to help with whatever thing you need. They'll be taking over all the incident management team meetings, which they pretty much do already. So that will be an easy transition on their end. But if there's anything else that you need from them or something that you would need from Laura, just having a conversation about that.
Okay. All right, so as far as signing authority, then Samantha, you're suggesting that we would give that to Laura?
Yeah.
Okay.
And Laura, as an office clerk, was working on the claims previously, so she has a lot of experience with that already in our accounts.
Okay.
And then she would be working with Megan in the auditor's office, who would be sort of the double check for that.
Okay,
So I don't see any issue with that.
all right,
That would just have to be a formal vote from the Board of Health that starting August 12th, the signing authority would go over to Laura or whoever you choose until the start of the new director.
okay. Is there a motion to that effect?
I can move.
Okay, so the motion is, we will be granting signing authority beginning August 12th until the new executive director starts to Laura.
I'll second that.
All right, any discussion? Hearing none, all those in favor of the motion, please say aye. Aye. Okay, motion passes. So Laura, you'll have that responsibility beginning August 12th. And then until we have an executive director on board. Now, concerning the support, does anyone have any other statements or thoughts they'd like to talk about? Or are you comfortable with kind of using the city and VNA as a resource for Laura and for Bailey until the new executive director starts? There's also, I think there's a possibility that should it be necessary, Samantha, you could do some consulting work from a distance, correct?
Yeah, I can help with that.
So I don't know if we want to do something about this now, or shall we wait until we get an answer about our executive director?
Let's wait.
All right.
What might there have to be a little bridge though? Maybe just update right here.
Pardon me?
I mean,
The new person would
Yes.
start by August 12th. We're not sure.
but then are we gonna have another meeting to approve someone signing authority in the,
No, we have the signing authority. We've
oh,
done.
I'm sorry, I missed the support.
We're doing the support.
My fault.
And I think Sandra and I talked about this too, that you could rely on board members for some support too.
Yeah.
So maybe just another comment, I hate to just jump in, but those claims are also, they will be given heightened review by the auditor's office, and then they also come to supervisors. So it isn't as if you're just handing a checkbook. Okay, so there's multiple steps here to review. I also wonder, Samantha, if you think that Becky Nowacek with Iowa Department of Public Health, she is the liaison as well. Can she give some extra support to the Department of Health at this time?
Yeah, she's actually been in communication with Laura already, and they've been talking about pinning down a date for an orientation type conversation. So that'll help. That'll be a good start at least.
Okay, good. And we have some good ideas, some thoughts. Should we need more support after August 12th? So we'll deal with that, I think, as time passes.
If we were to use Sam as a consultant, do we have funding for that, or how does that work?
We would have to look into that.
Okay.
Yeah.
Yeah, I'm not sure where that would come from the budget, or if you'd have to ask the supervisors for
special.
additional. Yeah, I'm not sure.
And that actually could be, if you were consulting, you could help the new director also somewhat.
Right.
So, yeah. All right, so we'll do some discovery and some discussion about that and see what we need, okay?
And can I ask one more question? Sarah? If board members were to provide support, we're 3 is a quorum now? Is that
Three is
right?
a quorum.
Okay, so just to keep in mind, if we were to meet, it would, only be 2 at this point.
2, yeah.
Right.
Good point.
Okay, very good. Now, as far as the next item is strategic planning, discussion, and job development. Those are actually 2 different things, so. We asked the Board of Supervisors to assign ARPA funds for a strategic planner. And I think the estimate was that might cost around $30,000. And that was not approved to use ARPA funds. Well, it wasn't approved. There wasn't even a motion by the Board of Supervisors to adopt that. So we didn't get support to use ARPA funds. Now, do we want to continue pursuing this and try to get it passed through the supervisors? Try to ask them for just regular money, like a budget amendment or something?
I don't think they're gonna support it till we get a new executive director. The strategic plan, so I don't know. I mean, we can plan all we want, but I just, based on what they said at the last meeting, I don't think we're gonna get any monetary support.
Prior to the director.
Well, and actually, there's been some, I received some communication after the last meeting, supervisors meeting I was at. Supervisor Wickham advised the Board of Health that he did not support using ARPA funds to grow the staff, but that he wants to use the budget process. And he definitely stated that he wants the executive director on board before we ask for more staff. It's my understanding that there's been other discussions, Samantha, Mr. Panoff has asked you to submit some job descriptions or something, or request for.
He said the same thing that Supervisor Wickham had said to you. I think he said that he would like to see those requests be fitting in with our regular budget, but that once there was a new executive director, he wouldn't be opposed to receiving personnel requisitions. So if we had some like job titles and descriptions prepared and then went over those with the new director or something like that, or even had her put those together if you thought that was appropriate, then they could start accepting them and making amendments to fit that in a regular budget rather than do it through ARPA. So I don't think they were opposed to getting more staff for the department. They were just opposed to doing it through this process.
And before an executive director is hired.
Yeah.
Well, so as far as asking for more staff, then I think it's probably premature to start asking for more staff because our executive director is not on board yet. But what about the strategic plan? Do you think we should try and ask for money for that so that once we get our executive director, it's ready to go, ready to start? Or should we wait?
What is the time frame you expect before the new director starts under ideal circumstances?
It would be, under ideal circumstances, it would be at least a month, I would say.
Okay. I mean, I think a month is time. If you're thinking about a big strategic picture of where this department should go, that I think I could live with that. I think we need the strategic evaluation. I think it's very important that somebody external does it. Personally, I think it has to happen anyway, and whether a new director is there or not would not make a huge difference because we still have to take an external look. Would it be helpful to have a new director with his or her visions about it? Absolutely, but it's not an absolute prerequisite for me, I would say. So, I mean, if we're talking about 1 to 2 months, I think that's not unreasonable, but if we're talking about in general and not, I would say, no, we need this evaluation because what we learn there, what we have to focus on, what we get there will help us also to get the new director some directions of where we need to go based on all the other assessments. I mean, we all have no 360 view, and what we're getting with an external consultant is closing a couple of the degrees of our view, and then we have the director that is new, and then we have our view, and I think we get a pretty good, well-rounded picture.
Do you think the Board of Supervisors would entertain using ARPA funds for that strategic planning? Yes.
I think that they would, and I personally think it's a really good proposal for ARPA funds. It's a one-time cost.
Exactly.
Yeah.
I think
When I
that-
was there,
Yeah.
I was there, it was before the Board of Supervisors, and nobody made a motion.
Because you were trying to do the whole 1.3. I think they would have given 30 or 40,000 for a consultant,
And I think,
but not for the whole
support for
thing.
Mr. Panoff was talking about, couldn't we just look at someone else's strategic plan?
Well, yeah, that's true.
And I didn't hear Jay really support that, Mr. Wickham really supported either, but if the board wants to go in front of the supervisors again and ask for ARPA funds for strategic planning, I would support that, but it didn't sound like they were.
I mean, if you think about the intention of these funding, it is really to rebuild things. And rebuilding means also that we learn from the lessons we just learned in the last 2 years and put it in place going forward. I mean, that's for me exactly the intent, the idea behind these fundings.
And I mean, my thought was to have a consultant chosen and ready to start when the new director is on board. You know, just not have to wait
Have it
another,
lined up. and
not wait
queued up.
60 days,
Right,
you
right,
know,
right.
but,
No, that is totally fine, but that would not be in contradiction what I just proposed
No.
saying, you know.
No, right.
no, it's not, but I'm just saying that that was my thought in front of this Board of Supervisors. Let's get prepared for when this new director starts, then we're ready to go with a strategic plan. So,
Yeah, I agree. I think we should have it in the queue, ready,
Yeah.
so we can
Okay.
go be off and running.
all right.
But it needs to be its own. We have to separate it from the
Positions.
other.
Positions.
Mhm.
Yeah.
So might I ask a question, Samantha, while you're still here with us? There's also the community health needs assessment, China HIP.
Yeah.
So when is that, when is that due? That is not a strategic plan, but that will be, the director will need to likely immediately start immersing him or herself into that process,
Yeah,
right?
that'll be due fall of 2023, I believe it is. It keeps getting pushed back because of the pandemic. I was actually meeting with Mary Rose and Stacy today, and in the past, it's been those two, plus some hospital representatives, and then our department director that are kind of like the core planning group for the China HIP. And so they're talking about those starting meetings, getting them prepared now. So we've got about a year for that. And Mary Rose and Stacy, working with a new director to the department, and they've already done a China HIP before. They're probably going to take the lead on that.
But that also is a detailed process. You also are short 2 board members. And so, how to go about, the supervisors have been appointing on a quarterly basis to boards and commissions. If you wish to have that be changed, we probably have to have some discussion about adding new members to the Board of Health more quickly than in a quarter. We just made appointments at the end of June, the 1st of July. So, you're looking for some delay there as well, potentially. So, into the strategic plan that was brought up, but I mean, I made a comment that a strategic plan with no intent to fund anything coming from a strategic plan is really not very helpful, right? I mean, if you're going to just do a plan or borrow one from another state or another county, there needs to be a commitment about the process to the work that you are committed to doing, which is, an examination and the story of what are the next steps. So I guess that's what I have to share, if it's helpful.
Which is why I think you bundled it. And
Well,
you
they-
didn't want to unbundle
They
it.
did, they said, because yes, Supervisor McDonough had made that comment at the Board of Supervisors meeting, and so then the other supervisors asked, well, is there more that you want? Other than more than this 30,000 for the strategic plan? And my answer was yes, $1.2 million. So, yes.
Yes.
So then that didn't go anywhere, so.
No,
So,
and then
I
there was
mean,
silence.
For a long time.
Well, I got uncomfortable.
if someone wants to make a motion, we can move forward with this.
So the motion would be to apply for the strategic consultant through the ARPA funding as a single one-time item, being ready when the new director steps into his or her role.
And then looking to write a budget amendment to fund the additional jobs that might come out of the strategic
Right.
plan. We need to put that in there too.
But, yeah, state that again.
That there would be a budget amendment to fund the additional jobs
A
that,
future budget,
Mhm, mhm,
request for budget.
mhm.
Okay.
that would come out of the strategic plan. And that way
And the new
you're looking
director-
ahead and you're
Yeah.
saying, we're not just gonna shelve it. We're not just doing this because it sounds good. We're doing it because we want to move this department forward.
Right, okay. So that sounds like a very good motion. That's a motion.
That's a
Is there a second?
I was like,
Okay. Any further discussion? Okay, all those in favor of the motion to request a strategic planning consultant using one-time ARPA funds and to follow that up with a future request for budget amendment to get further staff that the strategic plan might show that we need. Okay, all those in favor of the motion say aye.
Aye.
Those opposed, motion passes. Okay, so Samantha, I'm not sure if that has to be written up, so it's,
Yeah, we wrote up part of it when we did our large group presentation, so I can take pieces from that and put it in a document to send to the Board of Health.
okay,
And then I know we've worked with Stella a little bit on that too, so I'll get her input.
Board of Supervisors, you mean, or
Yeah.
you send it
You
to
said-
us first, or what?
You said Board of Health.
Oh, yeah, I meant I would send it to you first if you wanted
Send it
to
us.
look at it at
All
all.
right,
And then I need to talk with Stella about how that process works with ARPA. I don't know if we need to present it like an RFP, the way that we did with the after action report and get
Okay.
bids and stuff like that. So I'll have to talk to her,
All
but
right.
I'll keep you updated.
all right, thank you.
With respect to the job development, I guess, is that was in relation to the additional positions?
Additional staff, yeah.
So is it on here because we need to further critique those? Is that what Mr. Potoff was requesting, or?
I think he was requesting, he was kind of saying, I don't know, I didn't talk to him, so you talked to him, so.
Yeah, I think a little bit of that maybe, reevaluating the staff we're asking for. I think if we go with the plan that the board's just talked about with doing the strategic planning first, that's gonna give you a really good idea of what staff to ask for anyway. So I like that plan.
Okay.
Then we have a director or
Yeah,
council
right.
that might also have some ideas, so I think it's a good
Yeah.
timeline.
Yeah, and Supervisor Potoff's the one who said just have that, throughout the strategic planning process, if this is how it ends up working out, have those job titles and job descriptions ready and then start submitting those over time as budget amendments like Amy had mentioned.
Okay, so I mean, at this time, I don't think there's any reason to start with the job descriptions right now.
No, I don't think so, no. I think they'll be born out of the strategic
Yeah.
plan.
Now, there's been some discussion this past week about the environmental specialist and maybe that there needs to be some hiring to assist with that. Is there
Yeah.
something, is that something we want to talk about tonight or?
Yeah, we can talk about that. I think we've mentioned it before a little bit in Board of Health meetings, but now that we are doing so much more environmental work than we were doing in the past, I think we've all noticed in the office that an environmental specialist assistant or a second environmental specialist would be super beneficial. Even dividing up like the water testing and the septic and well stuff, making those two separate jobs we'd be able to get a lot more work done in environmental because the VNA covers a lot of our medical stuff and our grants, but we're really the only office that's doing that environmental piece. So that could be a good first position to look at, in my opinion. Or maybe you'd want to wait till strategic planning done before you asked for something like that, but that was just my 2 cents.
Do you think, or Bailey, are you still on? I don't know if she is. Okay, would it be a specialist or like an assistant or?
I could see it going either way.
Either way.
Yeah,
Now, Laura was cross-trained basically, so she knows water testing,
she does,
right?
yeah.
And the new clerk will also be?
Yeah.
Okay,
Neither of them have been certified, but they've both been trained and gone through like our own office orientation booklet for that.
Okay.
So Laura will probably be the next to get certified, but right now it's just Bailey and I who are certified.
and certified means you have to take a test or something?
Yeah,
Okay,
yeah.
all right.
Have septic, like installation inspections and stuff like that been going as well as hoped in terms of
Yeah.
new rollout stuff?
Yeah, it's
Uh,
going really good. I think the hardest part is time management for
Yeah,
Bailey because there's so many to inspect.
Mhm.
And then on top of it, doing water testing twice a week. So I think it's just, it could easily be 2 jobs, 2 full-time jobs, I think.
Yep.
And that's how a lot of other counties do it. The ones that she works with, they have either an assistant or more than one environmental specialist on board.
So help me understand the difference between the job description of an assistant and a full-time environmental specialist. Is it a pay grade thing or or the amount of hours worked or what's the difference?
Yeah, it might be the amount of hours worked. I think you could make it how you want to. It'd be certain projects that they're more focused on, probably. But I don't know. I think that you could do 2 full-time environmental specialists. And that's what the city of Dubuque has too. They have 2 full-time ones.
They do some things we don't do though, don't they? Like the
Yeah, they do more
restaurant.
restaurant inspections and stuff like that, but they also don't do septic inspections the way we do.
Okay. mean, I'm kind of feeling like we're hopefully so close to having the executive director, the new executive director, that maybe we should just hold on. But
Yeah, I also think there's a lot going on in the department too, training 2 new staff members and finding an executive director. So I understand waiting also. That makes sense to me.
Just let Bailey know that we still support her and
Yeah.
we're looking forward. We just
Yeah.
need to
Yeah, she's doing
pace
awesome
ourselves
stuff.
and, you know, do it the right way.
Yeah,
There's clearly a need for it.
Right.
is there
right.
any way a volunteer could help?
maybe I know like Adam has had some students help in the past, and then we have like the cheek program. They're not necessarily volunteers, they're just more people to help, more hands to help through their programs. But with a volunteer, they wouldn't be able to do water testing because that's all certification and stuff.
They would not be able to do that.
No, unless we pay for them to get certified.
Yeah, I was just wondering if there was an opportunity to partner with the colleges for
Yeah.
internships or something.
We have tried to do that.
Yeah.
Bailey's been talking with Adam. I think it's hard to get the ball rolling because Bailey's plate just keeps growing and stuff.
Can a volunteer go out and collect a water sample or no?
No, you have to be certified to do
You
that.
have to.
So over my term, there has been several points where I have asked the health department if they would allow us to hire or contract water testing. Adam, you might remember that.
I do.
And it has been met, your previous board members have said no and no way. So the idea of building capacity through contract work exists. It has been declined by the Board of Health. So, you know, exploring that again, whether it's a strength or a weakness, that's, you know, we're reluctant to take on more employees. That isn't to say we're reluctant to have more work be done.
What was the resistance before, you know?
I don't remember the resistance before. Yeah, because it was just before I got on when I think it officially happened, but I remember talk about it. But I think for me, adding, oh, sorry, you can comment on that if you'd like.
No, I mean, my understanding was from Patrice and Tom Beshan that is the job of the health department, and they were not interested in deviating from that. Now, many things have happened since that time. We've actually completed the grants to county program for the first time. We actually have 77 people who are on a waiting list. There's been tremendous marketing. So capacity is a question that you are now struggling with. And we've never done septic inspections like we are doing now. So it's a capacity question, but you know, exploring who might be able to do water testing, meeting the standards set forth by your Board of Health, that is a conversation that's never really happened. It's been considered, but it's always been foreclosed. So I don't know that that threatens the autonomy of the health department to have, you know, the University of Iowa is doing water testing. Adam, you're doing water testing. So can we build capacity with another partner that we would still be compensating for that? So it's not, it's just previous board members have said no,
I mean, is
but
that
also a
something-
previous director said that.
Yeah. Is that something that could be a temporary solution, let's say, until we have a strategic planning, the new director, and then the evaluation, do we need, which sounds like 2 full specialists, but we still want to get the work done until then, right? So I mean, that would be something.
Right. And in my mind, it's a win-win situation to have college students getting that hands-on, excellent hands-on education. And it's a win for the health department to have extra hands working. So I think it's a different board, and I think we are at a different place than the old board and old director, where, I mean, we don't have a director right now, but if we're steering the ship, you know, we can.
Right, we just don't have enough employees to do the supervision, right? So I mean, at this point, we have 2 employees. 3, no, we have 2. We have Laura, I guess we have Bailey, and then you have a full-time clerk, Tina.
So
So
3,
you're
yeah.
3, all who are very new. So it's a great concept. I don't know that you want that to be tomorrow's headline in the newspaper, that you're going to be, you know, hiring more water testers. Maybe you do.
No, but it's something to consider.
It kind of seems, I mean, it kind of seems like a contract employee would be good to get us over the bump.
Yeah.
You know, the hump, so
Absolutely.
it's not, it doesn't seem like we're ready to take action tonight. I don't know.
No, I agree. Yeah.
So is it something you would contract out to say University of Iowa or
Or, yeah,
what,
how much does it cost
Is
to
that
get certified, do you know?
To get certified?
Yeah.
I don't remember. I wanted to say it was like $300 when I did it, but I could be wrong.
Yeah, 'cause what does seem like it would be just a easy, not easy, but a summer internship thing where,
Yeah, and Bailey and I talked about that too, if
Yeah.
people ever interned, and that might be a better route to start at least, because in the winter, things are totally different for the environmental specialist.
And how quickly from my education do you get certified? Is this like something that takes 6 months? Is it something you can do in 3 weeks or?
So we created our own office orientation policy, I guess you could say. And so they have to be supervised for 30 tests and we get about 5 a day. So
Happens
that could go by
relatively
fast.
quickly, yeah.
Yeah,
So it could
Yeah,
happen within a
okay.
month or
Yeah.
3
yeah.
months.
And then the test itself is a 2-day process. So
So it's not something that is onerous and long
No,
time. Cool.
no.
Okay.
The test is online, I suppose.
no, we order the kit and then you do the test. I guess, I don't know, I don't remember off the top of my head how quick we get the results of our test back, but you actually do a test where you're like putting E. coli samples in a bottle and you have to let it in the incubator for 24 hours and then read those samples the next day. And then send your results of the reading off to the organization we get certified through.
Sounds like a great thing for a summer intern.
Yeah.
All right, well, let's keep that, we'll keep that brainstorming going. I don't think we need to take action tonight on it. Okay, unfinished business, executive director updates. Okay, so we made an offer, the Board of Health made an offer last Friday to a very well received candidate. The Board of Health endorsed her, and so did our panel. So there's still some negotiating going on, so we don't have a final answer. When she was told that the offer was being made to her, she was thrilled, is what we were told. She was thrilled to get the offer, and now there's just some logistics that she and her family, they're trying to work out, and anticipates that we will have an answer by Monday. Once we get an answer, there will be a, if it's a positive answer, I think we would do a press release. And then we would notify the Board of Health as soon as we know. So other than that, if anyone has a home for rent with a fence that will take an older dog, let us know. Because that's what's being looked.
Oh, is that what's?
Yeah.
Okay. Did she find, I gave a couple realtor names. Did she?
Yeah,
know she
nobody,
contacted?
as of this afternoon, nobody had contacted her, and I had given a name too, and so I called that realtor and I said, if this person calls you, call them.
Yeah, yeah, because I
But-
can put
Yeah,
a bug
it could
in.
be because they're looking for rentals, maybe, that a lot of realtors maybe aren't interested, I'm not sure. If you know a realtor that specializes in rentals, maybe that's what. we
Greg
need to-
Adams left too soon.
Yeah. We could have used
Well,
some
that's
negotiation
smart.
there. Okay, so hopefully Monday we'll have positive news on that. Is there any new business to discuss tonight? Do any of the board members have communications or reports they'd like to make tonight? Okay, our next meeting will be August 17th, 2022. And I just wanted to say that I won't be here for the September meeting, Adam, so
Okay.
you might want to make sure,
Yeah.
either you or we'll have to make sure someone can be
Yeah,
here
I'll
to
make
run the
sure.
meeting.
would it be important? I guess I'm a little bit confused about how we go about obtaining more members, given our 2 recent resignations. I know Speaker or Supervisor McDonough spoke that it would be probably July, August, October. Do we have the ability to ask?
That's what I
Them
was
to do it
wondering, if
sooner?
we could put a special request in.
Supervisor McDonough, if we wanted not to wait for appointments to the Board of Health, could we come to the supervisors and ask you to do it sooner?
I think you could just write a letter or something, Sandra, but maybe we want to do a press release. It's always good to look at, we have, we keep applications on file for a year, but it might also be worthwhile to just send a press release and give people 2 weeks or something to send in an application.
Okay,
We're looking for a man and a woman. We want to have for, and we do not necessarily have to have gender identity. We've changed the form for that. So, but, we try to keep a balance in board members. So all applicants would be acceptable at this time.
okay. Who takes care of the press release?
I can work on that with Ed.
Okay.
Yeah.
All right, good. I think, is that,
Yeah.
Good action.
We need to make a motion or anything on that?
I don't think so.
I don't think so.
Okay.
And then, once the press release is done, do we need to do a letter to the supervisors, Supervisor McDonough, or will you just, once the press release is done?
Ed Raver usually releases a press release. He's got
Okay.
kind of a standard form for this.
Right.
I think it would be best either to write to Chair Potoff or to the auditor and just ask that, that there be another applications considered. I think when you're in the news, it's good to always give opportunity for additional applicants and not just be confined to the applications, some of which are obviously aging, right? So, the call to the community is always, I think, helps build greater transparency if there's an opportunity.
Okay. All right, so I think we're in favor of writing to the auditor from the Board of Health stating that we would appreciate appointments in the future, near future, and not wait for the next quarter. But then we want to wait the couple weeks after the press release too, so that should be probably in the letter.
Sounds
Okay.
good.
All right, very good. Anything else? All good things? All right. At this time, anyone may address the board on matters of which are of concern to that person and which are not agenda items. Please raise your hand on Zoom, state your name and home address. If you're here in the room, please just raise your hand and we'll acknowledge you. Please be aware that the board is limited in their ability to respond to such inquiries, and Iowa code prohibits the board from deliberating or acting on items not appearing on the agenda. Individual remarks are limited to 3 minutes. Does anyone wish to make a public comment?
Can I ask, the China hip that you were saying, what is that?
Could you give your name and street?
Kathy Wymasker, 6559 Weber Road.
Is that okay?
What was the name?
Kathy Wymasker.
Okay, and your question again, I'm sorry.
When she was referencing the China hip, what is that? Or is it, did I understand correctly? Maybe it's not, maybe I'm not saying it right.
Go ahead.
Yeah, okay. China HIP stands for Community Health Needs Assessment and Health Improvement Plan. And I don't know off the top of my head, but I think we do it every 3 years. And it's sort of like a community-wide survey that gives us information on ways we can improve our public health efforts in the county or things that are not working, basically. And we have a copy of our most recent one on the county website if you want to look at it.
Thank you. So it was just an acronym.
Yeah.
Right.
Okay.
Okay, any other public comments tonight?
Can I just ask a question about what you guys were talking about earlier or no?
No, this
This
can't
is
be on
supposed,
the,
this is
agenda.
supposed to be for things that are not on the agenda. So,
Can we email? Can we
Yeah, you
email
could either email me or ask the question now, and then it'll get brought up at the next Board of Health meeting with the
we
answer.
just can't respond, really. Do you want to ask your question and?
I think we need to know your name and address though.
Harlan Castle, I live on Rush Street in Dubuque. And I'm just learning like what you guys are doing and stuff. So with the variance, I didn't know if you could clarify when you had said, you don't want to set a precedent in that. I mean, if it's legal for them to request a variance, I don't know, it was just kind of sounding like, just deny it. Like you didn't, why are you requesting a variance? Does that make sense? And so I was just a little confused as to if it's okay for them to request a variance. It was sounding like it wasn't okay for them to request a variance.
Oh,
Is that okay?
All right, well, we'll get a response to you, and then I think some of the question is, what is the standard that we use to determine whether we should grant the variance or not?
Exactly, yeah, that'd be helpful.
Okay,
That'll be at the next Board of Health meeting.
all right, are there any other public comments? Hearing none, is there a motion to adjourn? Okay, it's been moved and seconded. Any discussion? Hearing none, all those in favor of adjourning the meeting, say aye. Aye. All right, very good.
Are those the thank you?
Yes.
Yeah.
Thank you.
Samantha,
Wait,
is
wait,
this
wait,
a, is this our opportunity to say thank you to you?
Yes.
Yeah,
Yes.
wait
Oh,
a
my
minute.
goodness.
Time out. See, if it's not on the agenda, I don't do it. Okay,
Oh my gosh. You didn't have to do
Samantha,
that.
this is Samantha's last meeting with us as the interim director and as the assistant director. And so we just wanted to take a couple of minutes to thank you for what you've done for the Department of Health here in Dubuque County and how much help you have been to the Board of Health. It's been fantastic working with you, and I am so looking forward to you getting your PhD and coming back to Dubuque County.
Thank you. I loved working for all of you too, and with you, I guess. I did not know this was going to be my path leading into the COVID pandemic, but I am so grateful for it because I've learned more in the last 2 years than I have in all my schooling before that. So I really appreciate this opportunity a ton.
And I want to give all the other board members a chance to speak if they'd like to, so.
No, I would just say you've been amazing. I started working with you at the beginning of COVID regarding vaccines, and I've just been nothing but impressed with your resilience and your ability to like move with what's happening and just, flex to what's needed. So I wish you nothing but the best, and we are very sad to lose you.
Thank you.
Yes, I would echo that. I would like to go back in time and have your skill set, passion, energy, excitement, because you're gonna do fantastic things. So yeah, I'm super excited for you. See where you're at.
I think you're pretty much a baptism by fire.
Yes.
But you passed it really with flying colors and with outstanding excellence. And anybody who gets you after us can be called very lucky. So
Thank you.
you were great.
Appreciate it.
Well, I've known Sam since she was about 9 years old.
Aw.
And so it's just been a real treat to see her grow and blossom into this just very intelligent woman. And I'm just so excited. It was so fun to work with you on my proposal and to meet all those community stakeholders and have meetings with them. And I think it helped you grow too, and to see, how you network and build things. And so I just wish you nothing but success. Your class just astounds me, and you're just another person in that class who is going to do great things in this world. So thank you.
Yeah, I mean, I would.
And I have embarrassing pictures I will be posting. No, Sam was a very cute girl, and I always don't know who she is because she had blonde hair back.
Oh, yeah.
Yeah, I couldn't have done it without you all, and I've learned so much from each of you, so thank you.
Samantha, somehow we recruited you back home once. You go get your PhD in all things, but come home, please consider coming home again. That's very helpful to us. So thank you for all you've done.
Yeah, thank you, Anne, I appreciate it.
Sow your wild oats and then get back here.
Yeah, yes. And have fun while you're doing it. I mean, take every opportunity that you're given because you're going to be a great place full of history and just excitement.
I'm so excited.
And she showed me a picture of the house that she got.
Yeah, we bought a house.
Little ranch and.
So, yeah, I'm anxious to get out there and see it. I haven't seen it in person.
When do classes start?
September 6th.
Oh, you have some time.
Yeah. Yeah, to move and everything, get packed up.
Well, open up your stuff because we
Oh, we
don't know what it is really. We kind of know. but we don't
Probably
know.
hard first. Yeah. Thank you. Wow, we didn't have to do any of that.
That's a wine cooler, just in case you're, I mean,
I mean, you have to live a life. too.
right. Exactly. Yeah.
Thank you. Oh, very cool. I love that. You didn't see it.
Thank
Yeah, that's so cute.
Don't forget.
Thank you all so much. I really appreciate it.
Well, it will help that your parents are here so that you
Yeah.
will have to come
Yeah,
back.
you guys will probably see me.
Thank you, everyone. Good night.
Thank you.
Same.
use that one.